Tonight I'm going to be talking about fluoride and whether that's a good or bad thing for your teeth and your health, and whether it's a little bit of a myth that fluoride actually reduces tooth decay. So just to start on that, is fluoride a good or a bad thing? Well, as a dentist, you'd probably expect me to say it's a good thing. And seeing as it supposedly reduces tooth decay, then this is why dentists feel that you should use fluoride, use fluoridated toothpaste, and that it's good to have fluoride in the water. So it might surprise you to hear me say that I actually don't think it's so good for us. Essentially, fluoride is a poison and it's not a nutrient. It's not a vitamin or a mineral that your body needs to be healthy or to survive. You don't get tooth decay because of fluoride deficiency. And just to clear that up, there actually is no such thing as being fluoride deficient, because your body doesn't require it to function. It's not a nutrient. It has no physiological reaction in the human body that actually requires fluoride for it to work. It's not required for any aspect of human growth, development, or reproduction. So I'm going to explain why I'm not such a big fan of fluoride. Now, fluoride is very much everywhere due to it being dosed in the public water supply. And that started in the 1940s, I think around 1945 in the United States, and was added to the Brisbane water supply where I live in 2009. So the belief is that ingesting fluoride through your drinking water was going to prevent cavities in children. And the first area that was fluoridated was Michigan in the USA. And the statistics showed that there was about a 60% reduction in fluoride in the fluoridated area of tooth decay. So in about 3,000 school children, 60% of them had reduced decay. And that was then the green light to add fluoride to the water in cities and towns across the globe. Now the claim is that today that fluoride reduces tooth decay by around 25%. So is it really worthwhile us drinking fluoride for a 25% reduction? Now, 25% seems like a large amount, but really is it if it's making the difference between two teeth that are decayed versus one tooth that's decayed? I don't know how we put a value on that. So thank you for being here and listening. If you're enjoying this, if you find that it gives you value, please give us some hearts, share the video, tell your friends about it, and let's get the information out there. So as I said, tooth decay is not caused by a deficiency in fluoride. Its role in water in toothpaste is actually intended to harden the enamel, which is the outer layer of your teeth, and that supposedly should make them more decay resistant. But, and this is a big but, that's not all that fluoride does in our body. Once it's ingested, it upsets a special protein called collagen, and that's like the scaffolding or the building block for many structures in our body. And this disturbance in the collagen causes damage to bone formation, the way the teeth grow. It damages the connective tissue, which is the bits that kind of hold everything together in the body. It also damages the arteries and the skin. So what the fluoride does is it actually unwraps the collagen protein and makes it useless for its purpose. Another thing that concerns me is that putting fluoride in the water is mass medication. It's medicating populations without their consent. You don't get a measured dosage, and there's no respect given for any pre-existing health conditions or any medications that you might already be on. So if a doctor or a dentist wants to prescribe something to you, we have to explain what that is, what it does, what the benefits are, what the possible side effects are, and get your consent. You then are given a prescribed dosage based on your size, your health, your age, etc. And also we're going to prescribe things that fit in with whatever health conditions or medications you're already on. So it seems odd to me that we're putting a medication in the water without considering all these factors. So when you ingest fluoride, either in the form of tablets, drops, or when it's in the drinking water, it's claimed to reduce dental decay. It's supposed to give strength to the tooth enamel while it's growing and the teeth are developing in jaws. Now essentially all the adult teeth have fully formed enamel by about the age of 6 or 7 years old. So you could assume that ingesting fluoride past this point possibly no longer is beneficial to the teeth. So over this age, the same claimed benefits can be achieved from the use of topical applications. That means putting it directly onto the tooth. So using fluoride via a toothpaste or a mouthwash and that sort of thing, varnishes and gels that the dentist can apply. So why do we actually need to drink fluoride in our water supply if it's not as beneficial as they claim? Well, the experts tell us that fluoride is present in very small concentrations, that therefore we don't need to worry about it. And it actually keeps our enamel strong no matter what your age. But 1 part per million of fluoride in the water supply, as I said before, it's an amount, it's not a dosage. So you've got individuals, and one might drink a very small quantity of water while another drinks several litres a day. So one person is consuming much more fluoride than the other in this case. And it also does not take into account our fluoride exposure from other sources like in our toothpaste and food or any medications that we're taking. So it's been seen that chronic exposure to what are called safe doses of fluoride consumed over a period of time could be detrimental to our health, because fluoride actually accumulates within our body. It's what's called a bioaccumulator. And once it's there, it's very hard for our body to dislodge it and remove it. Now, there's been talk that fluoride is linked to things like brittle bones, thyroid disorders, iodine deficiency, kidney disease, and even brain cell damage. And there's suggestions that if you have symptoms of irritability, anxiety, or nervousness, you could actually be suffering from overexposure to fluoride. Fluoride's also been said to cause abdominal cramping, diarrhea and constipation, and it can even cause lack of mobility and stiffness in the joints. Now look, the debate's going to rage over the safety and effectiveness of fluoride and its potential health issues. But adding fluoride to the drinking water, it just takes away the individual freedom to choose whether you want to be exposed to fluoride or not. Look, if it's in the tap water, yes, we can remove it. There are filters that we can apply to our taps and to our drinking water, but really would it be better just not to put it in the water in the first place and make fluoride tablets and drops available if people want to drink them? So thanks for being here live. Thanks if you're watching the replay. We're going to talk a little bit more now about why fluoride's in our water supply. How did it end up there if it's actually a poison and it's not good for us? If you've got any questions, please leave them in the comments in the chat. I'll try and answer them live, or if not, we could do a whole video about those questions. So do keep those questions coming. So it ended up in our water supply a little bit by maybe accident or maybe a bit of a conspiracy theory, depending on how you want to look at it. So fluoride started out as an industrial waste byproduct of aluminium production. And in the early 1900s, manufacturers just dumped it into landfill and rivers. And it was discovered that it was actually poisoning nearby crops, making livestock sick and actually killing livestock in some instances. Now, this was a problem because it meant now that the aluminium manufacturers had no means of dumping their byproducts and had to find another way of getting rid of the fluoride waste. So just to jump a little bit around here, just bear with me, that there's quite a lot to say on this topic, so I've just got to make sure I refer to my notes and try and get my facts as straight as I can here. In 1931, researchers found that there was a link between fluoride and tooth decay. So they'd studied areas in remote towns where there was naturally high concentrations of calcium fluorides in their water wells. So the aluminium company set out to do their own research on this, and they sent a dentist to study these remote towns. They even set up their own research institute. And what these studies showed is that the dentist found a link between high fluoride in the drinking water and mottled tooth enamel. And when the tooth enamel is mottled in this way, this is called dental fluorosis. It's actually damaged from ingesting too much fluoride, and the enamel doesn't grow properly. And so if you looked at the enamel structure, it's crystals all laid down together. So you can imagine like a bag of dried spaghetti, and all the strands are all lined up together. that's what tooth enamel looks like. It's really, really neat. When it's had too much fluoride, because of that collagen unzipping, it's like cooked spaghetti that's been thrown on a plate. So the enamel becomes poorly organised and becomes more porous. So you see changes in the texture and the colour of the tooth. So they researched this, and they showed that these calcium fluoride concentrations would cause fluorosis in the enamel. So the aluminium company had set up a research centre called the Mellons Institute, and it was aimed to support industries, and they were behind producing some of the research that showed asbestos was safe and did not cause cancer, for example. And the research was done, supposedly, I mean, I don't know this for a fact, but this is stuff that I've read, that the research was done to help companies find ways to get rid of their toxic waste. So in 1939, one of their scientists contended that rather than removing the fluoride from the food and water, that they should allow a level of contaminant of about 1 part per million, because it's going to prevent dental decay. Because they'd seen these changes in these areas where they'd got naturally occurring fluoride. So they went on to produce reports that assured us that fluoride was non-toxic and would be beneficial to add to the drinking water for healthy teeth. And these reports were even supported by the American Dental Association. Now, this strikes me as a little bit similar to what the tobacco industries did with their research to show there was no harm from smoking, and also what the sugar industries have done in recent years since the 1960s in sponsoring their own research to show no harm. So in the mid to late 1940s, a group from the US Health Department was set up to look at the effects of fluoride. Now, these studies were classified and they were not released for a long time afterwards. And the studies showed that fluoride was detrimental to living organisms. It had effects on the central nervous system, leading to drowsiness, mental confusion, and lethargy. And in the 1950s, the fluoride was defined as being a violent poison to all living tissue. It was also stated that any constant ingestion of non-fatal doses could cause permanent inhibition to growth, and the use of fluoride-containing toothpaste and internal medicaments was not justified. Now, this was published in a document, and it was later removed as being seen to be politically incorrect, because now the move was to support public fluoridation in the water and programs in order to prevent tooth decay. So if we look at it, fluoride has never been proven to be safe. It's never been proven to be effective at reducing tooth decay. It's just something that we've kind of latched onto based on research that is possibly of dubious origin. So it's interesting that at the same time that fluoride was being declared as a violent poison in the 1950s, that the US Public Health Services officially endorsed the concept of adding fluorides to the water supplies. This was the same year that Alcoa Aluminium, who set up the research institutes, their plant in Canada was found guilty of dumping tons of toxic fluorides each month into a nearby river, resulting in the death of many head of cattle. So it just makes me wonder exactly what was going on there. So when it comes to fluoride, you can see there's been a lot of subterfuge, no different to the tobacco industry, no different to the expose recently that we've had on sugar, where sugar's covered up the fact that maybe it causes cardiovascular disease and made fat the enemy. So yes, I agree, Dana, there's been a lot of facts that have been turned around to serve the needs of business and not the public and not our health and well-being. So there's been numerous studies around the risks of fluoride and fluoridation, yet these were and have been ignored. Now, thankfully, it's now illegal for industry to dump fluoride in the lakes and rivers, but somehow it's considered perfectly fine to put it in our drinking water and toothpaste, a bit like mixing mercury into dental amalgam and then saying that's okay to put in our teeth, when we all know that mercury is actually very, very toxic. So these days our exposure to fluoride is greater than ever as commercial crops are watered with fluoridated water. And so the foods that we eat absorb fluoride, which we then ingest as part of the food chain. A lot of fruit juices made from concentrate are reconstituted with fluoridated water. Food products manufactured with water, and even some bottled waters contain fluoride. So if you live in a fluoridated area, you're drinking it, you're bathing in it, and you're being exposed to it every day. And we don't really know what consequences that's having on our health and well-being. Yes, I think if the public did know, that they'd be more concerned. But we've been sold, Diana's just making some comments and really appreciating that, we've been sold this belief based on you have fluoride, you're not going to get tooth decay. Now look, I'll just go off on a little bit of a tangent here. I grew up in a fluoridated area and I don't have any cavities. I've got really good teeth. But I don't think that's just from fluoride. My parents were really, really keen for us not to end up with a head full of cavities and dental amalgam fillings like they'd had. So my mum was very, very staunch on us not having processed foods, not having refined sugars, not eating cakes and biscuits. They were a treat from time to time. We had sweets occasionally and would have to go brush our teeth. No, I never had soft drink until I was a teenager, and we had cordial very rarely. So I didn't have tooth decay growing up, yet friends who lived in the same area, even on the same street, were having fillings, had decay, were even losing teeth, adult teeth as young as 12 and 13 from tooth decay. And their diets were very different to mine. They had a lot of soft drink, they had a lot of lollies and biscuits and ice cream and cakes, and a lot of refined and processed foods. So I even knew at that age that my diet and the way my mom made us look after our teeth really did make a huge difference. So I can't say that fluoride prevented my friends from getting tooth decay, because it certainly didn't. And I see that in patients where, you know, we have fluoride here in Brisbane, yet we still have rampant tooth decay in our children and also in adults. And it comes back to what we're eating and how much sugar we're having, the type of bacteria that we have present. So if fluoride does prevent tooth decay, it's a very, very small part of the equation, and we've got to go back and look at the fundamentals of good oral hygiene and good nutrition to stop this increase in dental decay that's just out of control. So thank you very much for being here live. Thank you very much if you're watching on the replay. I'm talking about fluoride and is it a myth as to whether it prevents tooth decay and what impact that it can have on your health and well-being. If you're enjoying this, please give us some hearts, as Facebook likes that. It gets us seen in more news feeds. And also if you're getting value from this, please share it. Make sure that we get this message out there. So originally sodium fluoride was added to our water supplies. And today it's a product called hydrofluorosilicic acid. I have to say that slowly because I can't get my tongue around it very easily. It's an industrial byproduct from the phosphate fertilizer industry. So they're making fertilizers from phosphates and they're getting this hydrofluorosilicic acid left behind. I think you can give only one heart at a time, Dana, but keep going with your comments. Thank you. I'm glad you're enjoying this. So in the US alone, fluoride is consumed by over 140 million people. That's a big figure. These silicofluorides have never been submitted to the Food and Drugs Administration for approval. They're banned in most of Europe, and the EU have even got some human rights legislation around making it illegal to fluoridate the water with these silicofluorides. Now, plenty of scientists have spoken out against the modern day use of fluoride to the point that they even got fired from their positions and their research was discredited. So there was one such study that showed that fluoride is a neurotoxin, which means that it damages the brain, and that it was causing effects such as hyperactivity and memory problems and IQ problems in the lab rats that they were testing. Now, the woman who conducted this study was fired from Harvard and her career was destroyed. What are they trying to hide? So in 2015, after a growing body of scientific studies showed that overexposure to fluoride does contribute to health concerns, The recommended level of fluoride in the water was lowered from 1 part per million to 0.7 parts per million. And that was recommended in the 1960s at level of 1 part to 1.2 parts per million. So we're now supposed to only have 0.7 parts per million, which is quite a reduction, but they don't have to conform to this. The water suppliers don't have an enforcement, so they can still use 1 part per million to 1.2 parts per million. So it's interesting that they said let's lower it, but they haven't made that law yet. So what are the health effects of fluoride? Well, one of the biggest things is that damage to collagen. So essentially fluoride is prematurely aging us from the moment we first ingest it in our water. It's very bad for our body. There is no system that fluoride does not disrupt. Fluoride forms an ion. It's really, really aggressive. It takes part in a lot of chemical reactions and it pushes a lot of other chemicals out of the way. So it damages our enzymes and proteins. It upsets the immune system, and there's been talk that it's linked to causal of autoimmune conditions, and it even damages the DNA. So it builds up in our body over time, very much like heavy metals do. So the problems with fluoride tend to start showing up around middle age. And so a lot of these issues, they're put down to aging, and it's your age, it's your hormones, it's stress, etc. But one of the earliest and most visible effects of too much fluoride is dental fluorosis, and that's seen on the teeth. They come through mottled, even discoloured, and in severe cases they can be quite brown and orange and very, very mottled. So they're pitted and they don't form properly, and that is because the fluoride is damaging and altering the way the enamel grows and forms. And so when you've got pitted and weak enamel, you're actually going to have more tooth decay. So this process of fluorosis hardens and alters the enamel crystal structure of the teeth, and it has the same effect on the bone. Bones and teeth are very, very similar. In fact, I would consider them to be almost one and the same. So if your bones are becoming harder and the structure's being altered, this puts you at higher risk of hip fractures due to fluoride in your system. Fluoride also binds calcium, and there's talk of it calcifying the pituitary gland and the pineal gland in the brain, also calcifying arteries and putting us at risk of cardiovascular disease. Now, one of the things that I find quite fascinating and very interesting, and also quite alarming, is that in the US, toothpaste there carry a fluoride warning. It says that there's a poisons warning actually on the toothpaste. And it states that if your child swallows more than a pea-sized amount of that toothpaste, you need to take them to a poison control centre. And look, this is really real. I mean, there's been, sadly, cases of children dying as a result of swallowing toothpaste. So I'm going to let you draw your own conclusions on that one. So thanks for joining me live. It's really nice to have you here. I hope you're getting some value and enjoying this. And now I'm just going to talk a little bit more about one of the major concerns of fluoride. So one of the biggest problems of fluoride overexposure is the impact that this has on your thyroid gland. So this is a gland here in the base of your neck. It helps regulate your other glands in your system and is very much in control of your metabolism. You can't live without your thyroid gland. If that stops working, you're gone, okay? So the thyroid actually uses iodine to make its hormones called T3 and T4, and iodine and fluoride are from the same elemental group. So if you looked on the chemistry chart, they belong to the same family. So fluoride is fiercely competitive, and it will block iodine from binding to its sites in the thyroid gland. Now your gland needs that iodine to produce its hormones and for those hormones to work properly. So you might actually have enough T3 and T4 in your blood tests, which tells you that everything seems fine with your thyroid, but it's not working properly because there's a cuckoo in the nest. There's this imposter there blocking the iodine getting into the gland and making those hormones active. It's an imposter, and you could have an underactive thyroid with symptoms of weight gain, lethargy and feeling cold yet the tests say that your thyroid's fine. So let's make this worse and throw a bit of mercury into the mix. Let's put some toxins, some stressors, some environmental chemicals in there, and we start seeing what is an increased risk for a condition called Hashimoto's thyroiditis. Now, this is an autoimmune disorder where you start producing antibodies that attack your own thyroid gland. If your thyroid's being poisoned and it can't work properly, you're in a mess. You're going to either be underactive and you feel exhausted and you've got to gain weight and you're just going to be sluggish, or you can be overactive and you're actually over-metabolising, and both are very, very dangerous. Hey Joe, nice to see you here from just outside of Brisbane. If you suspect you've got a thyroid problem, then please seek medical support. Look for maybe an integrative GP who will do more testing and look a bit deeper than just looking at those thyroid levels, because it really is a serious condition. Now, as a holistic dentist and as part of holistic dentistry, we advise that you don't drink fluoridated water. We also suggest and recommend using non-fluoridated toothpaste and mouthwashes and rinses that don't have fluoride in. In my dental office, we don't apply any fluoride treatments or use fluoride. We filter our water, so all the water that is in our office, what we use for our own drinking water, for our patients' drinks, cups of teas, etc., we filter. So all that water contains no fluoride. So the water that you rinse with, and even the water that's coming through our dental equipment, is fluoride free. And as I said, is our drinking water. So if you're concerned about ingesting fluoride and you know it's in your water supply, then it's worth investing in a fluoride eliminating system in your home to reduce your exposure, something like a reverse osmosis. So you just need to do your research and find out the best system for you and your budget. But here's some other things that you can do to reduce your exposure. You can drink non-fluoridated water. You can check the bottle labels and make sure that they don't contain traces of it. You can choose a fluoride-free toothpaste and mouth rinse. So I'm fascinated by human logic, and this I find intriguing, and I've always wondered this, even as a young child, because this is the way my mind works. Why would we drink something and pour it inside our body to protect the outer layer of our teeth? Logic says to me you should put something on the teeth and not drink it. It's a bit like saying, okay, let's drink a big bottle of sunblock to protect my skin. Makes no sense. I mean, surely if I'm going to protect my skin, I put something on it. You know, I wouldn't drink the sunblock or inject it into my body and think that's going to stop me getting sunburn. So if you want to protect the enamel on your teeth, surely we should be putting something on the top of it and around it and not swallowing it. Makes sense to me. So if you want to use fluoride, that's probably the best way to do it. But there are also other things that can go on your teeth to help protect you. Now, the biggest way to prevent dental decay is through good nutrition and a healthy lifestyle. And as I said, then you can apply things onto the teeth rather than ingesting fluoride and having it go to your whole body and mainly your bones. So things that are naturally antibacterial and support your tooth enamel are things like hydrogen peroxide, there's essential oils, and even coconut oil. Coconut oil is actually antibacterial. So in our dental office here at Evolve Dental Healing, we use remineralising paste with lots of calcium and phosphates and special proteins that help pull those minerals into the tooth structure. We can use ozone to treat the deep grooves in your teeth and make them more resilient to tooth decay. And ozone is just oxygen that's been treated in a special way to be antibacterial. So thank you for watching live. Thank you for watching the replay. Please share. Let's give us some hearts. Let's get this out there. So as I said earlier, fluoride accumulates over time. It's going to build up in your body. And so when your dentist is using things like concentrated fluoride treatments and gels, or prescribing fluoride mouth rinses and products to you for you to use at home, this is adding to your dosage and the build-up of fluoride in your system. So there's so much more I could go into, and I could go on and on about fluoride forever. But for now, I feel that this is a good introduction on how it got into our water supply. And have we fallen for the magic bullet that it's going to prevent dental decay. And I think to some degree we've been sold a bit of a lemon that if we drink fluoride, dental decay is going to decrease. Well, when they first started adding it to the water supply around the 1940s, 1950s, they showed that there was a decrease in tooth decay. But what they didn't tell us was that that exact same decrease was happening in non-fluoridated areas, because there'd been a big push to educate people about the importance of oral hygiene and brushing their teeth and not consuming too much sugar. So I'm going to tell you that no amount of fluoride is going to compensate for a poor diet and poor oral care. And sadly, when we swallowed the lie about fluoride, we also swallowed a substance that's detrimental to our health and the proper functioning of our body, under this misguided notion that fluoride was going to stop our teeth from rotting. So I actually am going to say to you that I believe it's a myth that fluoride prevents tooth decay. And I'm going to be booed by a lot of my colleagues in the dental profession, and I say that's fine. We're all entitled to our opinion, and I'm just sharing mine here tonight based on information and research that I've read over the years. And so there are ways to prevent tooth decay without having to ingest fluoride. There are ways to prevent tooth decay without having to mass medicate communities without consent. So if you want to put fluoride on your teeth, that makes sense to you and you want to do that, that's fine. Apply it with your fluoridated toothpaste, but you don't need to be swallowing it as well. So thank you for joining me. Please do give us some comments, ask questions. If you want to know anything more on this topic, I can do another video. I'm sure there's lots more we can say. It's great that we've had an international audience tonight. I love seeing people from Europe and Australia and across the globe joining me. Please share the video. If you'd like to know more about fluoride, then you can contact me by private message. Or if you want to use a dentist that you know is holistic and isn't going to put fluoride in your mouth because you're concerned about the effects that that may have on your health, then please call us on 0737 20 1811. We'd be delighted to book you an appointment and have a consultation with you. Nice to see you here, Giselle. If you're just tuning in, then I'm sorry, I'm just about to wrap up and say goodnight, but please feel free to watch the replay, and thank you very much for joining us. And next time I'm going to talk about TMJ and bite dysfunction. So if you do have problems with your jaw joints or your bite, then, or you're just interested in that, then feel free to join me next week and I'll talk more about that, and we can come back and explore the topic of fluoride again. So thank you very much. Have a lovely time. Thank you for joining me live, and thank you for watching the replay. I'm Dr. Rachel Hall of Evolve Dental Healing in Kenmore, just outside of Brisbane, Australia. Thank you very much.